5th. I apologize to everyone. I've been over to Mansion doing some stuff, meeting with some folks, and it just ran over. And as you know, there's lots going on in lots of different areas across the state right now, and a lot of opportunities, a lot of good stuff. And but at the same time, we absolutely want to continue to recognize, especially those that we've lost, and be so respectful to everyone. You know, since last Wednesday, we've lost an additional 28 people in West Virginia. It's impossible for me to believe that sounds good, but considering, you know, when you're sitting here going through 110 different folks, 28 surely better than that. But nevertheless, I ask for your prayers. I continue to do so. I think really and truly that God above is in control, and He's going to get us through this. And West Virginia has done very, very, very well to get through this to this point, and I truly believe in all my heart we're going to get through it. But nevertheless, our 4,491st death is a 50-year-old male from Tyler County. Our 4,492nd death is a 68-year-old female from Tyler County. Our 4,493rd death is an 85-year-old male from Fayette County. Our 4,494th death, a 79-year-old male from Kanawha County. Our 4,495th death, a 54-year-old male from Tyler County. Our 4,496th death, a 53-year-old male from Roane County. Our 4,497th death, a 54-year-old male from Fayette County. Our 4,498th death, an 80-year-old female from Wetzel County. Our 4,499th death, a 66-year-old female from Tyler County. Our 4,500th death is a 62-year-old male from Greenbrier County. Our 4,501st death is a 79-year-old female from Raleigh County. Our 4,502nd death is an 80-year-old female from Cabell County. Our 4,503rd death is a 90-year-old female from Wetzel County. Our 4,504th death is a 69-year-old female from Ohio County. Our 4,505th death is a 63-year-old female from Berkeley County. Our 4,506th death is a 72-year-old male from Kanawha County. Our 4,507th death is a 58-year-old male from Nicholas County. Our 4,508th death is a 63-year-old female from Mercer County. Our 4,509th death is a 77-year-old male from Raleigh County. Our 4,510th death is an 81-year-old male from Marion County. Our 4,511th death is a 62-year-old male from Harrison County. Our 4,512th death is a 73-year-old male from Marion County. Our 4,513th death is a 91-year-old male from Preston County. Our 4,514th death is a 57-year-old male from Harrison County. Our 4,515th death is an 84-year-old female from Harrison County. Our 4,516th death is a 51-year-old male from Raleigh County. Our 4,517th death is a 72-year-old male from Wood County. And our 4,518th death is a 54-year-old female from Kanawha County. It's really hard to believe, isn't it? 4,518 people have died in West Virginia from this dreaded, dreaded, dreaded pandemic. I remind you again and again that 92.2% of those people that have passed away were not vaccinated. Your odds are so much better, so much better if you are vaccinated. From the standpoint of our active cases, we're at 6,832 right now. We have 871 new positive cases today. Our daily positivity rate is at 6.62. Our cumulative rate is at 6.12. The recovered cases are just right at 265,000 people in West Virginia. There's 543 that are hospitalized. That's down significantly, as well as 192 in the ICU units and 103 on ventilators. We have 4 green counties in the state of West Virginia. They continue to be in the north central part of West Virginia, and we congratulate those counties for doing a lot of really great work. There are currently 40 school outbreaks in 19 counties, 612 confirmed cases. The federal vaccine requirement is rolling out now. And while I adamantly disagree with what's going on with the Biden administration in regard to this, it is a federal requirement that is rolling out. It will trump our state, wishes and everything I sent up in the form of a bill, and we passed it in our legislature to forbid people from being terminated from their jobs and if they had religious or medical conditions in regard to their wishes to not take the vaccine. I think with all in me, we should absolutely be respectful of people's freedoms of choice. That's what made this country absolutely the great country that we are today. I do believe that while they rolled out and said that January the 4th will be the date, I do believe that that will not happen. Our Attorney General, Patrick Morrisey, today announced that he has partnered with 6 other attorney generals to file a petition before the 6th U.S. Circuit Court of Appeals challenging the Biden administration's vaccine mandate. I think there are upteen lawsuits all over the place in regard to challenging this, and I cannot imagine with the track record, with the shipwreck that happened to the Democratic Party in the elections just last Tuesday, I cannot imagine that we're continuing to plow down these paths that absolutely infringe on every one of our good people. Now, do I really believe that you ought to get vaccinated? Of course I do. I've said it over and over. Do I encourage every time I come on? Of course I do. Do I absolutely believe that it enhances your odds of not getting sick and absolutely phenomenally enhances them from the standpoint of the potential death? Of course it does. But it still should be absolutely, we should abide by our Constitution. It should be a choice of the people, freedom. That's how I believe. That's exactly what I think. And we'll monitor this and we'll keep watching it. Like I said, there's a ton of lawsuits that are opposing this and everything. Do I feel in my heart that this will become law on January 4th? Not unless there is a complete reversal in the surge that we have going on. I do not think that this will become law, but nevertheless, that's what it is right now. And without any question, the federal mandate, the federal law trumps us. And so, nevertheless, just stay tuned and let's just see what happens. From the standpoint of the boosters, the CDC has recommended all, Pfizer, Moderna, J&J, we can give those boosters and absolutely all the information's up on our hotline and everything. You should be getting your booster shot. You should listen to me. You should really be getting your booster shot. If you, in your wisdom, decided to get vaccinated, you got vaccinated for a reason, because you felt it would protect you, and it did. And then you got your follow-up shot because you decided that it would protect you and you had to get the 2 shots. With J&J, only 1. I get that. But the thing that you have got to realize now is those vaccines have worn off to some degree. To some degree. Your booster puts you back to where you were when you had the vaccines, when you completed the 2 shots. Today, you are not protected. You are not protected anywhere close to what you may think. You need to get that booster shot. Since we have dropped our eligibility to 5 and older now, we are now back at 62.2% of the entire eligible West Virginians 5 and older. We are at 69.6 of 18 and older. We are at 84.1 of 50 and older and 95.2 of 65 and older. So from the standpoint of our 50 and older and 65 and older, we're in great shape. But we absolutely now need to go on a strong campaign to try with all in us to be able to get all those from 5 to 11 and those from 12 right on up to, whatever it may be to middle age, that we need to get them vaccinated. Like I said, the vaccine eligibility now is absolutely free, and it's for 5 and older. I encourage over and over and over our parents, our grandparents to help me get our young people vaccinated. This is the simplest way to keep them really protected. I said at the last briefing, I said just this, and I think that number was correct. In excess of 120 people, kids, we've lost in this country due to this pandemic. I cannot think of one situation that I've been advised of where a kid has been vaccinated where we have grave, issues. But we've lost 120 kids. To lose one kid is tragic beyond all comprehension. But to lose 120 kids in this country, really, when it boils right down to it, what is that screaming at us? It's screaming at us, get these kids vaccinated. Get these kids vaccinated right now and protect them. We do not need to continue to lose our children. So absolutely, I encourage with all in me that you'll please get these kids vaccinated. All the vaccine info stuff is up there. Reminders, if you're 65 and older, you get any symptoms whatsoever, go get tested. If you're tested and you test positive, the antibodies will save your life. You ought to really consider wearing a mask if you're 65 and older and you've got any kind of, medical condition whatsoever. If you're going to be in a crowd of people indoors, you ought to have a mask on. From the standpoint of our grand families, now that drops down to 5 and older. So we probably got well in excess of those 19,000 kids in those families and everything. They're going to get a school voucher, $150. Grand families, come on. We need you to get all those kids vaccinated. All the free testing is available. We thank Frutz. We thank Walgreens, as I've done all the time. We've got 40 outbreaks in our long-term care facilities, only one still in our church community, and that's still in Nicholas County. Corrections, we've got 15 inmate and 27 staff cases right now. I encourage you over and over about getting your flu shots. You can do it at the same time as your COVID shot. I tell people over and over and over, I've said this about this rental assistance program. There are millions, tens of millions of dollars that are waiting there for people that are struggling. If you're a renter or if you're a landlord, call us. These are dollars that we have available and we can get in your hands if you'll just call us and go through this. I've announced, as I've said before, about our veterans discounts at all our state parks. Let's salute all those veterans, especially coming up over Veterans Day. But those discounts are going to be, for reservations, I think up through March 31st of 2022, and so take advantage. Our state parks are, beyond beautiful and everything, and they've been upgraded like crazy. And $100 million we spent on state parks, and I thank Steve McDaniel. What a job him and his people have done. Unbelievable. Our state parks are showing off right now, and so really and truly take advantage, veterans and everything. You deserve it in every way. We're going on daylight savings time at Sunday, 2 a.m. This means that you'll get an extra hour of sleep, but the sunsets will be earlier in the afternoons. As we all know, it'll get dark sooner and everything, and it's a good time of year to check, just as a reminder that your batteries are in great shape for your smoke detectors or your carbon monoxide detectors, and that you've got some level of weather radio there at your house. It's a great time to check those monitors, and like I said, one more time, check your smoke detectors and check your carbon monoxide detectors. This is a great reminder, of a time of year to do that. So take advantage and try to do that. And the only other thing I've got is there's, both our universities have jointly received a grant worth $678,030 from the National Institutes of Health. So that's Marshall and WVU, and these grants are to study, the COVID variants and everything. And so more dollars coming to our universities to help us, and those great people do great work all the time. And so that's all I got. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. In support of what the governor has said, this is another important moment for us. As we look around the country and around the world, we see that in places that are getting colder, they're starting to see upticks in the number of COVID-19 cases and hospitalizations. This is particularly true in Europe and in parts of our country where the weather is changing now. So it's a really important time for all West Virginians to decide to be fully vaccinated. There's some recent information that's come out from a large Veterans Administration study. And as the governor said, we see that there is a fairly strong reduction in the protection from all 3 vaccines available to prevent people from getting ill or from getting COVID-19 itself. And Johnson & Johnson has the most drop off after 6 months for protecting people from getting infected. But all 3 vaccines are still working to prevent people from getting severe disease, hospitalization, and death. But they've also dropped off by about 50% in most of the vaccines. So it's really important for people who are susceptible. And we talked last press brief that data from Israel said in their booster campaign that people over 40 years old got a substantial benefit as far as reduction in severity of illness and death from getting boosters. So it's really time to get your booster if you're 6 months after your Johnson & Johnson, or I'm sorry, your Pfizer or Moderna vaccine, or 2 months after your Johnson & Johnson vaccine and are 18 years old or older. The other thing that's really important today is it's great that we have vaccines available for 5 through 11-year-olds. And I'm sure that General Hoyer will talk more about that during this press brief as far as all the numbers are concerned. But it is important because people have asked, well, is it safe to vaccinate 5 through 11-year-olds, and should we? And the answer is yes, it is safe. The studies that have been done that led to approval by FDA and CDC showed that no child in that study got inflammation of the heart, which is one of the side effects that we had seen with higher doses, very rare side effect, but a side effect with higher doses of some of the mRNA vaccines of Pfizer and Moderna. Remember, this dose is a third, is 10 micrograms versus the adult dose of 30 micrograms for the children. And also we know that about 8,300 children have been hospitalized in our country, 172 children, that's in the 5 to 11-year-old age, have died in our country. And the cases of the multi-system inflammatory syndrome, the MIS-C, are seeing 44% of those cases in children 5 to 11 years old, and long COVID has also been reported in this age group. So to help prevent those kind of health problems in our children, to protect their lives, to get them back to being able to have more normal lives, whether it's in the classroom or on the playground, and also to reduce the spread of COVID-19 in our country, particularly at a time that we're all about to go back inside as the weather gets colder. All those reasons really does suggest that it is really important for parents to choose to get vaccinated themselves and boosted as they're appropriate to do so based on the time of vaccination, and to vaccinate your children, including your 5 to 11-year-olds. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to reinforce some of the points that the governor made related to both first doses and booster doses. Just want folks to understand that we had been on a good track with reduction in our transmission rate, but over the past number of days, that has plateaued at 0.84% and now has actually gone back up. In addition to that, while we have made good progress in the reduction of the number of people in our hospitals down to 541, if you will look at the numbers, we actually have 199 in ICU and 105 on ventilators. And as the governor has pointed out, and we've all pointed out today, that 14% of those in ICU are folks who have been fully vaccinated and 12% of those on ventilators. And again, as the governor pointed out, while we've made great progress in first and full vaccination of our 50 plus population and our 65 plus population, the point that he makes that is so important is that we must really attack rapidly getting booster doses in those folks because of what we know and what the data shows us as to their vulnerability. And again, those who are unvaccinated as well as those who are vaccinated but are waning and need the booster dose are those that are most at risk in West Virginia. So we've got to continue West Virginians make the decision to get vaccinated. I'd also like to highlight an issue that came up in the Bluefield newspaper where the insinuation was made that doses were not sent to the Mercer County Health Department for our children. And Dr. Amjad will cover more specifics on this as to why, but that health department has been asked to stop conducting vaccinations due to some issues that Dr. Amjad will cover. But we want to make sure that people know at the governor's direction, we made sure, and our task force and DHHR made sure there are outlets in Mercer County for children to get vaccinated. Four Seasons Pharmacy, Walgreens Pharmacy, and Kroger's Pharmacy are all working as of this morning to establish appointments for young people to get vaccinated. And Bluestone Community Health Center is receiving their doses today and is also already engaged with the Mercer County School Board for those who want to get vaccinated through that process. All this has been coordinated over the last several days and been working. So just want to assure people in the southern part of the state, particularly Mercer County, we are working and continue to work to make sure that your children have access to vaccinations. And I'll turn it over to Dr. Amjad to address the specific issues related to vaccines in the health department.
Good morning. Thanks, Jim. So regarding Mercer County, so there are vaccines available in Mercer County. As Jim mentioned, there are the pharmacies and Bluestone Health Clinic. So as part of the Bureau for Public Health, we do pride ourselves in quality assurance, and there is a system in place for any vaccine administration error. So if there is a health department that is having any quality assurance issues, vaccine administration errors, such as dosing administration errors, and in this case, Moderna boosters were given full doses instead of half doses. So this can happen at any time, and it is not a punitive error where we will stop vaccines. We want to ensure that quality is given, the right doses are given, and it's a temporary hold in this case. And it does happen across the state. It's a temporary issue where vaccines will be halted. Our team is going to go in next week to make sure that the vaccines can be given in the right doses. And this is not something that just happens necessarily just in Mercer County. It's happened in other counties across the state. But what's going to happen here is our team's going to go into Mercer County, make sure that the vaccines can be given adequately. But we want to assure people in Mercer County that there are other places. So you can go to Bluestone Health Clinic, as Jim mentioned. You can go to 3 different pharmacies in that case. But we want to make sure that people are getting the vaccines correctly, because vaccines are very important to get. We want to make people comfortable, but this is something that was brought up in the newspaper that we did not send vaccines to the health department, but that's absolutely not true. If you're not going to give them correctly, then we have to put a hold on them, because we want to make sure patients get the right dose, that there's quality and assurance in place, because that is what the Bureau is here to do. So we just want to make sure that's very clear to the people in the state right now. But if there's any questions, we're here to answer them. Thank you.
All right, thank you both. Major General Jim Hoyer and Dr. Inamjad. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. I want to mention another update to the dashboard this morning. On the overview page, you will notice that we have added the 5 to 11 age range based upon the new our ability to provide immunizations to those ages. On the vaccine summary page, we've also added a 5 to 11 bar percentage for that age group, and the key metrics box was changed from 12 plus to 5 plus. If you want to see the count for 5 to 11 or any age group, you can select that age group and tap on that bar, and you will get specific key metrics for that age group. This dashboard is very interactive. If you play around with it a little while, you'll find quite a few things on there that probably aren't obvious at first view, but some of the numbers and percentages will look different. The eligible population has increased by 141,000, that age group of 5 to 11. So that population is now 1.699 million rather than the 1.557 million. And if you'll notice, West Virginia is approaching 2 million. We're over 1.9 million in doses given, vaccine doses given in West Virginia, which is very impressive. In the U.S., of course, we've given 425 million doses of this vaccine nationwide. In addition, worldwide, we have given, the world has given 7.2 billion doses of this vaccine. This vaccine is safe. As the governor says, and as Clay says, get vaccinated. You will protect yourself from COVID and from long COVID. So please get vaccinated and get your booster. Thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Marsh. Dr. Marsh, could you address parents that have children under the age of 5? What can they be doing to keep the youngest children safe? And how long do you think it'll be until we have a vaccine for our youngest age group from, newborn to 5? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. That's a really important question. And the thing that parents can do to provide the most safety for their children is to be fully vaccinated and to get their siblings who are in the vaccine eligible categories to also get fully vaccinated. And for parents, it's not only full vaccination, but it's also keeping up and making sure that they get their boosters, because we know the best protection in keeping people from being infected with COVID-19 is to be fully vaccinated and up to date with your vaccinations. We do know that more studies are going on in younger children, and it will likely be probably by the end of this calendar year to the beginning of next calendar year where we'll see some of the results from that. As the younger and younger children are approached with vaccine, it's really important that the dosage be adjusted appropriately. And a lot of these studies may be longer in duration to get the number of children to be part of that vaccine, because as the kids get younger, the vaccine dosing will likely change some. So we'll keep looking at that, but full vaccination is the most important thing that parents could do to protect their children who are still too young to be vaccinated themselves.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everybody. I think we've probably all run into somebody that fits this category, somebody that believes that they have had COVID and that they have natural antibody protection as a result. The question would be, well, number one, an observation. If you didn't have it and you think you had it, you have no protection if you haven't been vaccinated. But if you have had it, and has there been any studies done to see how your immunity wears off? Does it wear off as quickly as the vaccine immunity appears to have done after 4 to 6 months in many cases? Or does that stay with you for a while? I'm a bit confused. Medical people, can you help me out? Thank you.
Dr. Marsh, you're going to handle this. I think what Dr. Marsh will say is, you know, your natural immunities are great. You know, maybe not quite as good as the vaccine, but Dr. Marsh, you tell them. You know more than I.
Thank you, Governor, and thank you, Paul. This is an issue that's very confusing to a lot of people, Paul. And the truth is that we know that there certainly is, you know, benefit from having had COVID related to your immune function. But what we also know that a lot of the response is very person dependent. It relates to which form of COVID you've been infected with. For instance, the first COVID from Wuhan, China, versus the Delta variant are very, very different viruses, and the Delta variant is massively more infectious than the first virus from China. It also depends on your own immune system and the severity of the illness, which usually generates more immune response. So because we can count very exactly when people were vaccinated, and we're following populations of people who've been vaccinated, as I just talked about the VA study. We talked about before a study from Israel with 728,000 people in a group that got boosters or didn't, that all were fully vaccinated. We have the ability, Paul, to be able to track very carefully and exactly what happens to the vaccines over time. So we can really make those recommendations to people on the timing of boosters and what kind of boosters they might think about getting in a way that we have great insights because of all the studies being done. At the native immunity, there's much more variability. And for a lot of people, the timing of their immune response is not consistent, is inconsistent between people. So we would still say that everybody who's been infected with COVID-19, please consider full vaccination, because we know that combination gives you the highest levels of antibodies and the most immune protection. And we also know that most of the people in our hospital beds, in our ICU beds, who are dying of COVID-19 or who are getting long COVID are people that have not been vaccinated. And that certainly includes a lot of people that have had a previous infection with COVID-19. Thank you.
Thank you, Paul. Next, we'll go to Mark Cram with WDVM.
Good morning, Governor. Good morning to our esteemed panel. Always appreciate your time. My question today comes from a mother in Berkeley County who says, are there any medications or shots that should not be given near or at the same time as a COVID shot? And should parents consult with their family physician prior to getting a COVID shot for their youngster? Thank you.
Okay, we're back to Dr. Amjad. Or Dr. Amjad, take this one, please.
Yes, Governor. Mark, there isn't one. And in fact, with the young kids, some have been missing their routine vaccinations because of the school year prior to that. So we recommend, of course, talking to your healthcare provider, but there isn't one that's on top of my mind right now. So we'd want you to obviously speak to your doctors, but there isn't anything that, unless your kid is allergic to something, that you shouldn't have one. In fact, most doctors will say to get your flu vaccine with the COVID vaccine at the same time, so you don't have to take your children back and forth to get vaccines right now. And a lot of kids are missing their routine vaccinations right now. So if your kid can get both vaccines, like the flu vaccine and the COVID vaccine right now, that would be preferred rather than taking them back and forth. So right off the top of my head, no. But if your kid has any issues, definitely talk to your healthcare provider would be my answer right now. So, thank you.
Thank you, Mark. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, Governor and panel. I am wondering about the COVID surge as it relates to deaths. So we know that our COVID cases peaked and then have fallen. That's the same with hospitalizations. I'm wondering if our deaths have already peaked, since that is the last indicator of a surge, and also that it's a little harder to tell based on the data on the dashboard, considering that deaths are, not reported on a day-to-day basis. Some deaths, it might take them days or weeks to get processed. Any help on that would be great. Thank you.
General Hoyer, maybe you can do this one, sir.
Yes, sir, Governor. So June, as you point out, tends to be a lag time related to deaths, both because of number of people going to both the ICU, being on ventilators, and the time with which they unfortunately suffer with this dreaded disease, and also the final confirmation and reporting. What we believe right now is we still have a path of additional deaths in West Virginia based on that, even though we have hit that peak of cases back in September. And as you will recall, the governor and his team brought that up early on during September and continued to reinforce that we are not out of the woods yet related to unfortunately losing more West Virginians due to COVID.
All right, thank you, June. Governor, I'll turn it back to you.
Okay, let me just see. Before I conclude, let me say one thing real quick. I was watching all of our experts and panelists that we have with us every day, and I was watching them as we go through the questions and how they try to give you the absolute truth, full disclosure all the time, and great and accurate answers. And I just thought, whether it be Dr. Marsh or Secretary Crouch or General Hoyer and all the great work that they do, it's unbelievable. But I was just sitting there just thinking, as Dr. Amjad was answering a question and everything, aren't we blessed? Aren't we so blessed that she took this job and this incredible work that she's done? So to all of them, I am deeply, deeply, deeply thankful, and as we should all be, because they've really stepped up. They've done great work. Lots of people behind the scenes are doing great work as well, but a special thanks to all of them. Only other thing that I've got is we sure want to reassure that all the folks that are down in Mercer County, absolutely, that we have vaccines that are there. We did have a hiccup from the standpoint of, and I only found out about that this morning, that there was some reporting that was done by I think a gentleman at the Monroe County Health Department to the newspaper that we weren't sending vaccines, and conveniently, or to Mercer County, the Mercer County Health Department, that we weren't sending vaccines down there, and that's preposterous. I think and again, I don't know all the detail and everything, and I'm just being told this, from our people right now. But the net of the whole thing is, we had to put a hold on the situation to the health department, not to the pharmacies and not to the others, because the health department was giving out the wrong amount of doses to people. That's the bottom line, and we got to get that straightened out. We don't want them to continue doing the wrong stuff to people. And it wasn't a real danger, I don't think, but at the same time, there's still plenty of vaccines. And so to the people of Mercer County, I don't know if people are trying to cover up for themselves or their shortcoming there and everything, or whatever the situation may be, but there's plenty of vaccines in Mercer County, and we're going to get this situation cleaned up with the health department. And we make mistakes and everything. This is not a mistake that, as I understand it, that's going to cause any situation to those people that got the additional amount, and they should have gotten a half dose, they got full doses and everything. But we'll get that cleaned up too. But nevertheless, that's all I've got. And again, a special thanks to all those that, of our experts that come on each and every day, and they've done phenomenal work. And I can't thank them enough for all the information and stuff that they've given me. So thank y'all so much. Anyway, thank all of you. Bye-bye.